Welcome everybody. Let's take you on a tour to help you to get a quick general overview of the heart. Now we're going to do that by sort of taking you through this little pathway. First thing we want to know is how does the blood flow within the heart. We'll take a look at that. And then following that, we're going to get to know the doorways that are located within the heartways, which allow the blood to flow in a sequential manner and a one-way path. Um, we'll Once we know the doorways, we know that the closures of these doorways causes the heart sounds that we appreciate with the stethoscopes. And we'll take that look at in part 3, where we'll try to look at the proper placement of the stethoscope to help you appreciate the heart sounds. Now the heart is pumping, and it's pumping because of the wiring that's present within the heart. And that's the fourth thing that I would like to look at very briefly, is how the heart's wiring is set up and how it allows the heart to pump through the doorways, and then which appreciates or makes these sounds. And then we're going to generally just briefly look at the EKG and what it allows us to appreciate and how it measures the electrical activity that's going on within the heart. So let's get ready. Hello everybody, let's get to know the heart a little better by trying to follow the blood flow through the heart as it would start from the right atrium. The blood finds its way into the right atria by three main routes. First of them is the superior vena cava. Most of the veins superior to the diaphragm are going to be draining into the brachiocephalic vein, which emerges on to give you the superior vena cava. The second route is through the inferior vena cava. All the venous blood from the lower limbs, the pelvis, drain into the common iliac veins, which merge on to form the inferior vena cava. And then you have the coronary sinus, which is sort of in the back. This is going to be draining all of the blood from the heart itself and then delivering it to the right atrium. Once the blood has found its way into the right atrium, it's going to be pumped into the right ventricle. And it's going to do that by going through a doorway. This doorway is called the tricuspid valve, or a doorway, or synonymous with valves. This valve is called tricuspid because of the three cusps that you can really readily appreciate. Here's one, here's two, here's the third cusp. So far, this blood here, as we mentioned, does not have any oxygen. So once now that it's found its way into the right ventricle, it wants to get the oxygen. It's going to do that by going to the lungs. Here, it's going to get pumped through the pulmonary valve into the pulmonary trunk and then eventually into the pulmonary artery to go to the lungs on either side to get the oxygen. Here, we're able to appreciate the pulmonary artery for the left side, and here's the right pulmonary artery. Once the blood has been oxygenated, it's going to return back to the left side of the heart into the atria and by the roots of pulmonary veins. This is the right pulmonary vein, and this is the left pulmonary veins. The oxygenated blood now is sitting in the left atria, and then it's now going to want to get into the left ventricle so that it can be pumped to the rest of the body. But it's going to get to that left ventricle by going through another doorway, which is called the bicuspid valve because of the two cusps, one cusp and the second cusp. This valve is also sometimes referred to as the mitral valve. From here, the blood, as it's sitting in the left ventricle, is going to be pumped to the rest of the body through one remaining doorway, which is the aortic valve, into the aortic trunk, and then into the aortic arch, into the rest of the systemic circuit. The heart sounds that we appreciate or auscultate with the help of the stethoscope, the lub-dub, are created when these doorways close that we looked at, the valves close. The tricuspid valve and the mitral valve are also collectively known as the AV valves, as they are sitting in between the atria and the ventricle on both sides. The pulmonary valve and the aortic valve are collectively known as the semilunar valves. The S1 is created, S1 sound, or lub-dub-lub sound, is created when you have the closures of the tricuspid and the bicuspid valves. The second heart sound, or S2, is created when you have the closures of the pulmonary valve and the aortic valve. Now that we know the proper pathway by which the blood is flowing through the heart, starting from the atria and all the way down to the systemic circuit, this is a good slide that sort of tells you the correct order by which the valves are opening and closing sequentially as we start again from the right atria. The T here is denoting the tricuspid valve, the B here is denoting the bicuspid valve, the P here is the pulmonic, or the pulmonary, and A is the aortic valve. In correct order, the valves open and close in this sequence. The tricuspid opens and closes first, the pulmonary opens and closes second, the bicuspid opens and closes third, and then the aortic valve opens and closes fourth. So it sort of creates an N starting. This is the first, second, third, and fourth. It's a nice, easy way to remember the correct order by which the valves are opening and closing. Let's review that the tricuspid and the bicuspid are collectively known as the AV valves, and they create the heart sounds. The heart sounds are created basically when these two are closing together. And the semilunar valves, which are the pulmonary and aortic, are going to be creating the S2 sounds when they close, and they are going to be closing at the same time, and they're going to be creating the S2 sound. Excellent, and now we know how the blood is flowing through the heart in correct sequence as it would start from the right atria, and we know the correct sequence of the opening and closures of the valves, starting again from the atria, right atria. Let's look here at what is the proper placement for the stethoscopes to allow you to best hear the closures of these valves. We'll start at the very top with the semilunar valves, the aortic and the pulmonic. The aortic valve is best heard in the second intercostal space, right sternal border. The pulmonary valve is best heard also in the second intercostal space, but on the left sternal border. The two remaining valves, which is the tricuspid and the mitral valve, or the AV valves, the tricuspid is best heard in the fifth intercostal space, left sternal border, and the mitral valve is best heard in the fifth intercostal space, mid-clavicular line. Here's the clavicle, and then there's the midpoint. If you go down, that's the mid-clavicular line. Let's also review really quickly again, as we just learned the closure of these two valves. The tricuspid and the mitral is going to be creating the S1 sound, and the closure of these two semilunar valves, which is the pulmonary and the aortic, are going to be creating the S2 sound. Let's now look at how the heart actually contracts with the help of the wiring that's present within it. Everything sort of starts here in this node known as the SA node. This is also sometimes referred to as the pacemaker of the heart. It's located very close to the opening of the superior vena cava. The electrical signals will start at this SA node and then carry on downwards to another node known as the AV node. The SA node will spread the signal out within the right atria with the help of the intranodular branch, and also carry that signal over into the left atria with the help of the intraatrial branch. From here, once it reaches the AV node, the signal has a delay of about 0.09 seconds before it's carried on down to the AV bundle, which is also sometimes referred to as the bundle of His, which splits into the left bundle branch and the right bundle branch. From here, it'll go down into the ventricles, progressing on to become eventually the Purkinje fibers. An EKG allows us a method by which we can measure the electrical activity of the heart as the atria are contracting and as the ventricles are contracting and relaxing. And we'll take a look at that in the preceding slides. An EKG is a great tool that we can utilize to help us measure the electrical activity within the heart. There are three main components that you'll appreciate on a normal EKG. There's a P wave, there's a QRX complex, and there's the T wave. The P wave denotes the bump that's appreciated when the atria are contracting. The QRX complex comes about when the ventricles are contracting. and the T wave is noted when you have the ventricles in relaxation. P wave, atria contracting, QRS complex when the ventricles are contracting, T wave when the ventricles are relaxing. Beyond the three components that were just mentioned, EKG also allows us to gather more information about a patient through looking at the intervals. First of all, we can measure the patient's heart rate by looking at the R to R interval. Measuring the distance between this R and this R will allow us to appreciate a patient's heart rate. This is where you are measuring the intervals, measuring the entire duration of an action potential that's occurring within the heart. And then you have something called a PR interval. This here is measuring the duration of the action potential as it's occurring within the atria, also alongside with that of the DILA that's occurring within the AV node. That's the PR interval. And one remaining interval is the QT interval. This here is an area that's giving us the entire duration of the ventricle depolarization and repolarization. So the entire duration of the ventricle action potential as it's occurring within the heart. Thank you for your time. Hope you found this to be useful.